There are 73 million baby boomers in America, and they are all getting old at the same time. By 2030, every single one of them will be over 65. That is not a trend. That is a tsunami. A silver tsunami, actually. And while most people are worried about what that means for Medicare and Social Security, savvy entrepreneurs like me and you are asking a completely different question. How do I build a business that serves this wave? And today, I'm breaking down 6 senior care businesses you should seriously consider opening right now, before this wave peaks. Hey, I'm Sarah Michelle. I'm a nurse, a wife, a mom of 4, and I'm opening a senior care home in my own house, and I also help other nurses and healthcare workers build real assets outside of bedside. Now, some of these businesses require a license, some don't, and some you can start from your living room. And I'm going to be real with you about all of it, including one that sounds easy, but is getting a lot of people in trouble. And also two that I have personal experience with. Let's get into it. Real quick, let me give you the numbers so you understand why I'm fired up about this. By 2034, for the first time in U.S. history, older adults will outnumber children. The demand for senior care services is projected to grow faster than almost any other industry over the next decade, and we do not have enough providers to meet it. That means if you are sitting on healthcare experience, a caregiving background, or even just a heart for serving this population, the market is literally waiting for you. This isn't about chasing trends. This is about building something that the world actually needs and making real money doing it. Okay, let's discuss. Number 1, adult daycare. Adult daycare is one of the most underrated senior care businesses out there. The concept is simple. Seniors come to a facility during the day for supervision, socialization, meals, activities, and sometimes light health services, and then they go home. It's a lifeline for family caregivers who need to work, go to school, or just handle errands during the day. And it's a service that is in serious short supply in most communities. What I love about adult daycare is that it serves people who don't need 24/7 care yet, but absolutely need structure and support. And the families, they are loyal because you're literally giving them their life back. Now, this does require licensing in most states, and you'll need a physical space, but it doesn't have to be huge. I've seen people start these in churches, community centers, even small commercial spaces. That's actually where I ran mine from, and I love the business so much. But my life shifted a bit, so I decided to close it last year. I still get calls weekly from families looking for adult day services. It's much needed. If you've got a background in activities, social work, therapy, or nursing, this is a serious contender. Number 2, a home health agency. Home health is probably the most well-known on this list, and for good reason. It is a massive industry, and it is only getting bigger. The idea is simple. Seniors want to stay home. Their families want them to stay home. A home health agency sends skilled nurses, aides, and therapists to them. Now, I want to be real with you about something, and this actually applies to every single business I'm covering today. None of these are weekend projects. I'm not saying that to scare you, but I don't want to sell you a fantasy either. Every one of these businesses requires real research, real startup steps, and real commitment. And home health is no exception. Licensing, billing, compliance, it's a process. But here's what I'll say. If you are already a nurse or a healthcare professional, you have a massive head start. You understand the clinical side. You just need to learn the business side. And if you don't want to build from scratch, franchises and acquisitions exist. You can buy into an established brand or purchase an existing agency that's already up and running. The demand is there. The money is there. It just requires real commitment. Once my care home is up and running smooth, I'm considering starting a home health agency. And y'all know I do what I say I'ma do, so stay tuned for that. Next up is number 3, NEMT, non-emergency medical transportation. This one flies under the radar. This is how seniors get to appointments, dialysis, therapy, procedures, and the need is enormous. Missed transportation is one of the top reasons people end up back in the hospital. What's interesting about NEMT is the barrier to entry can be lower. You need vehicles, drivers, insurance, and certification, but not necessarily a clinical license. and it pairs perfectly with other businesses. Transportation connects everything. That's a powerful place to be. Okay, this next one, number 4, is near and dear to my heart because this is what I'm opening right now, and that's senior care homes. Senior care homes come in a few different models, and I want to break down the actual difference because there is a lot of confusion out there. Adult family care homes, like what I'm opening, are small, licensed residential care settings inside your own home. And I mean that literally, you have to live there. That is actually the defining difference between an adult family care home and everything else on this list. You are not an operator who visits. You are a live-in owner. In Florida, you can serve up to 5 residents. It's intimate, it's personal, and when done right, it's an incredible business and an incredible quality of life for your residents. And here's something most people don't know. With an adult family care home, in a lot of counties here in Florida, you also don't have to worry about sprinkler systems, generators, or submitting a proof of financial ability to operate to the state. That's a formal financial document required for residential assisted living that has to be prepared by a CPA. The adult family care home path has a significantly lower barrier to entry, which is part of why I chose it. On to residential assisted living. Here, the owner does not have to live on site. In Florida, the standard is 6 residents, but depending on zoning and other factors, you can go higher than that. More residents, more staff, more revenue, and yes, more complexity. We have memory care, which is specialized care for residents with Alzheimer's or dementia. High demand, not enough providers. So there's such a need for quality memory care support. And here's something worth knowing. With the right specialty license, you can turn your care home into a memory care home, more income for you, and a genuine service to your community, because the need for memory care beds in this country is not a small thing. Now, here is something I need to say about all of these home-based models before you go any further. Before you sign a lease, before you buy a property, before you spend a single dollar, you need to be talking to your county zoning office, your fire department, your Department of Health, and your state licensing agency. All of them. Zoning alone can stop a care home before it starts. These aren't boxes you check at the end. They are your first conversations. Do not skip this step. All of these are licensed. All of these are regulated. And that's a good thing. Now let me pause for a sec, because I want to talk about independent living homes for seniors. This can absolutely work. Not every senior needs care. Some people just want community, affordable housing, a safe place with their peers, and for certain populations, veterans, low-income seniors, people who just need a roof and belonging, independent living fills a real gap. But I want to be honest with you about 2 things. First, the money. Compared to a licensed care home, the revenue ceiling is lower. You're charging rent, essentially. You're not billing for care services. So if your goal is maximum income, this is not your highest leverage option. Second, and this is important, you have to be honest about who is actually moving in, because what I'm seeing is operators opening independent living homes thinking their residents are truly independent and then realizing they're not. Medication management, help with bathing, supervision, and now they're providing care without a license. That is a liability nightmare. That is call to the state waiting to happen. In some states, that's criminal. So if you go this route, know your population, screen your residents carefully, and if their needs start to exceed what you're licensed or not licensed to provide, you need a plan for that. Independent living can be a beautiful thing for the right operator serving the right people. Just go in with your eyes open. Moving on to number 5, Senior Placement Advisor. A senior placement advisor helps families find the right senior living community for their loved one. Assisted living, memory care, residential care homes, independent living. You assess their needs, you know the options in your market, and you match them to the right place. Now here's the part that surprises most people. You don't charge the family anything. You get paid a referral fee by the facility the senior moves into. We're talking anywhere from 75 to 100% of the resident's first month's rent. If that's a $5,000 or $6,000 a month placement, you do the math. No clinical license required, no brick and mortar. You need to know your market, build relationships with facilities, and genuinely care about getting people into the right place. And here's why this is especially powerful for nurses and healthcare workers. You already speak this language. You understand levels of care. You know what to look for. That is a massive advantage over someone walking in off the street. This business also feeds directly into everything else we've talked about today. If you run a care home, a good placement advisor relationship means referrals coming your way. It's all connected. Last one, and this is the lowest barrier to entry. Number 6, senior concierge and companion care. We're talking errands, appointments, check-ins, connection. This is not medical care. This is human care. And the demand is real. Loneliness is a real issue in the senior population. Families will pay for peace of mind. Just know your boundaries. No medical services. But this can absolutely grow into an agency. So there you have it. 6 senior care businesses that are only becoming more relevant: adult daycare, home health, NEMT, senior care homes, senior placement advisor, and concierge care. Now, which one is right for you? That depends on your background, your budget, and the life you want to build. If you want me to go deeper on any of these, drop a comment and tell me which one. I read every single one. See you in the next one.